Union strong is how Bernie is going to take on the oligarchs. He's not just going to win the presidency. He's going to organize. He's going to double the membership in unions. He's going to get the unions strong. Hopefully, he's going to help the unions run over their weak-ass leadership, and he's going to get a powerful cohort of workers together to absolutely demand Medicare for all and all the other pillars, all the other planks of his party platform. The Bernie Party. It's not the Democratic Party platform. Although he has shifted the Overton window, and the Democratic Party is more willing to embrace Medicare for all and social and economic equity. So this is what Ashley says, Ashley PAYNE. My union is in a perpetual battle for decent health care coverage. It's a tactic of our employers to prevent us from striking against our terrible work conditions. If we had Medicare for all, we could demand much more at the bargaining table. We could demand much more in the way of working conditions. These are protesters supporting Medicare for all in a rally outside PHRMA headquarters on April 29th in Washington, D.C. That's a powerful picture. In Contra Costa County, one of the 9 Bay Area counties, I work in social services. As an elected union officer, I organize and represent our unit of eligibility workers and social workers. We are literally the ones who determine who is eligible to have access to what the United States has designed to be our social safety net. I have been in this job for more than 5 years. Rappers make songs about us. If you want food stamps, cash aid, or Medicaid, you come to me and my fellow union workers. If you're a mandated reporter and you call the referral line to report suspected child abuse, we are the ones who pick up the phones and investigate, removing children from dangerous homes where need be. We are the ones who determine whether an older person is eligible for in-home support services so that they can stay out of a nursing home. We are also disaster workers helping out fire-ridden neighbors just to the north of us in Sonoma County. Our jobs are sometimes dangerous because we visit people's homes who may not always have the resources to maintain a safe home for themselves, their family, and other occupants. We are regularly subjected to emotional, verbal, and sometimes even physical abuse and danger. Usually, many things have already gone wrong in a person's life before they land at our doorstep, requiring government assistance. All this is to say our job is stressful and the turnover in our unit is high. What makes our jobs even more stressful is knowing that we are only providing partial help. Many of the benefits we offer are means-tested instead of universally provided and adequately funded. Our clients need and deserve more help than what's on offer from the feds and the state. This means we are frequently having to explain to people why they are no longer eligible to receive assistance. We have to delicately navigate hearings and appeals over benefits that were only partially meeting their needs in the first place and have now been distorted and tampered with by whoever is in Congress or the state assembly and state senate those 2 years. If serving the public weren't hard enough already, our employer makes our jobs even more difficult. We suffer from chronic understaffing, which results in high caseloads, burnout, and high staff turnover. Our benefits package is expensive compared to surrounding Bay Area counties, even though we are, according to my large public sector union, the 4th wealthiest county in the state in the 5th largest economy in the world, the state of California. As Contra Costa County employees, we pay a hefty amount toward our health, dental, and vision insurances, especially in comparison to our peer agencies. Healthcare is the top concern heard from our 4,000-member labor coalition of 9 unions. Social services is highly gendered work, so we have a lot of women carrying dependents on their plans. I'm sure they have a lot of women of color. For those who are married, our spousal waiver rate is very high, meaning the county's plan is being waived in favor of their spouse's more affordable plan. The rates vary wildly, with no single plan being obviously more affordable. We are being robbed in Contra Costa County, as are so many workers across the United States. As part of our contract extensions are now due to expire in June 2022, last fall, our union spent vast amounts of time bargaining health care. We know this is the number one reason that drives staff and potential new hires out of the county and into neighboring agencies like City and County of San Francisco, Alameda County, and Solano County, all of which offer far more affordable health care benefits. The wage increases that we did win aren't felt in our paychecks because they have been eaten up by the January 1st increases to our health care plans. Year after year, our salaries continue to fall behind our peer agencies because of our exorbitant health care costs. In fact, we are still meeting over health care. Elected union officers and our union staff meet collectively every month with our employer to rework our healthcare system to move to a more sustainable solution. So the long and the short of it is that we don't want to be bargaining. I'm in a union too. We don't want to be bargaining for healthcare. We want that off the table so we can bargain for better working conditions. Now, the other point in this one, she's working for people who need help. That's her job, is to help people get help. And because of the way our country dysfunctions, she's not able to offer the help to people who really need it. So she wants her working conditions to be better. And I bet her working conditions would be a lot better if she could offer the help that people actually need instead of telling them why they can't have the help they need. I bet her job would be less dangerous physically and emotionally if she could actually provide people what they need. Sort of like being a teacher in an inner city school, or just being a teacher in a public system of higher education where they don't care about the disciplines that you care about, and they lay you off because you're teaching in something that they don't value, like music or philosophy or foreign languages. That's another soapbox. I'll get on that some other time. But it's really frustrating when you're working for bean counters, and I bet her frustration is higher than mine, and mine is very high when I have to tie both hands and one leg behind my back and still try to do the job that I'm passionate about. It's hard to stay passionate when the bean counters keep stripping you of the resources you need. So among ourselves, we union members know that we are wasting our time. We spend days and nights poring over spreadsheets, studying RFPs from health insurers, surveying our members about their chief health care concerns, and trying to divine why they chose one plan over another. Over time, this becomes an obstacle to bargaining for better working conditions to improve our public services. If we had Medicare for all, we could be marching on the boss about the numerous health and safety violations in our workplace. It feels like, I don't feel it, I know it is, a union-busting move for employers to be opposed to Medicare for all. That's a good point. It is a union-busting move when our employers are opposed to Medicare for all. If the bean counters in the Pennsylvania state system of higher education are opposed to Medicare for all, it's because they're trying to bust our union. IBB, that's a way that they're bargaining with us. They're trying to get us to agree with them in advance so we don't strike on their asses. And that's what they want. They don't want Medicare, they don't want health insurance off the table. They want to keep using that as a weapon in bargaining. Our union members are in these jobs to help people. Same with my union. It's a teachers union. Teachers unions, we're in our jobs to help people. We could have gone somewhere else to work, but we chose to work in social services so as to help provide for and protect some of the most vulnerable people in our communities, even if that means that some of our members make so little that their own kids qualify for the same Medicaid benefits we administer. Our employers should want their employees to stay and perform their jobs well because it helps the community. Oh yeah, they care about the community. Sure they do. Our employer is the government and the people who pull the strings of the government. The assholes like Jeff Bezos and Mark Zuckerberg, not a private company stealing value from their employees to generate profits at all costs. That's what the bean counters in the state system of higher education are. It's a private company stealing value from their employees to generate profits at all costs. In the state system of higher education, they're stealing value from their students too, putting them in crippling debt. So that's another side of the same coin. So we should be on the same side. You'd think the bean counters would want to be in the jobs they're in to help students or to help people who need Medicaid. But they're not. Unfortunately, we're not on the same side. Please subscribe. Please keep following the Bernie or Bust show and keep on burning. See you tomorrow.
Get on board the Bernie or Bust train. Come get on board the Bernie or Bust train. Once you hear that clickety-clack, there ain't no time for turning back. Get on board